Sarah thought her periods were just getting a bit unpredictable as she approached her 40s. The occasional heavy flow, some spotting between cycles, nothing that seemed alarming enough to worry about. After all, every woman she knew had period stories that seemed far worse than hers. But when she finally mentioned these changes to her doctor during a routine visit, what she discovered changed everything. Sarah's normal period changes weren't normal at all. They were her body's way of sending an urgent message about something much more serious happening inside. If you're watching this right now, you might be wondering about your own cycle. Maybe you've noticed some changes lately that you've been brushing off as stress, age, or just one of those things that happen to women. But what if I told you that your monthly cycle could be one of the most powerful early warning systems your body has for detecting certain types of cancer? Today, we're going to dive deep into something that affects half the world's population, but is still surrounded by so much silence and confusion. We'll explore how your menstrual cycle can actually serve as a monthly health report card, what changes should make you pick up the phone and call your doctor, and most importantly, how understanding these signals could literally save your life. But before we begin, I need you to understand something crucial. This video isn't meant to replace medical advice or send you into a panic about every little change in your cycle. Instead, it's about giving you the knowledge to advocate for yourself and recognize when your body might be trying to tell you something important. Knowledge is power, especially when it comes to your health. Let's start with the basics. Your menstrual cycle is incredibly complex. It's like a perfectly choreographed dance between your brain, ovaries, and uterus that happens every month. When this dance is disrupted, it often shows up in ways that are easy to dismiss as just period problems. But sometimes these disruptions are actually early warning signs of cancer. The connection between your menstrual cycle and cancer risk isn't something most people talk about, but the research is clear and compelling. Recent studies have shown that women with irregular or unusually long menstrual cycles in their 30s and 40s have a significantly higher risk of developing certain types of cancer, particularly what researchers call obesity-related cancers. But here's the thing that surprised even the scientists. This connection isn't limited to cancers of the reproductive system. We're talking about cancers throughout your body. So, what does this mean for you? Let's break it down in simple terms. Your menstrual cycle is controlled by a delicate balance of hormones, estrogen, progesterone, and others. When something disrupts this balance, it doesn't just affect your periods. It can create conditions in your body that make it easier for cancer cells to develop and grow. Think of it like this. If your body's hormonal system is the security system for a building, irregularities in your cycle might be like having some of the alarms turned off. Now, let's talk about the specific changes you should be watching for. But first, I want to address something important. Every woman's cycle is different, and what's normal for you might not be normal for your sister, your friend, or the woman sitting next to you. The key is knowing your own normal and recognizing when things change from that baseline. The first red flag to watch for is bleeding between periods. This is called intermenstrual bleeding, and while it can happen for many reasons, it's one of the most common early signs of endometrial cancer. That's cancer of the lining of the uterus. Now, occasional spotting can be normal, especially if you're on certain types of birth control or going through hormonal changes. But if you're suddenly experiencing bleeding between periods when you never did before, or if this bleeding is heavy or persistent, that's something your doctor needs to know about right away. Here's what's happening in your body when this occurs. The lining of your uterus, called the endometrium, normally builds up each month and then sheds during your period. But when cancer cells start growing in this lining, they can cause bleeding at unexpected times. It's like having a leak in a system that should be tightly controlled. The second major warning sign is changes in your period itself. This could mean periods that are suddenly much heavier than usual, lasting longer than they typically do, or becoming more painful. Now, I know what you might be thinking. Periods can naturally change as we age, and that's true. But sudden, significant changes are different from the gradual shifts that happen over time. Let me tell you about Maria's story. Maria had always had what she called easy periods, 5 days, moderate flow, minimal cramping. Then at age 42, her periods suddenly became what she described as like a crime scene. She was changing super tampons every hour for the first 3 days, something that had never happened before. She initially blamed it on stress from a job change, but when this continued for 3 months, her sister convinced her to see a doctor. That decision probably saved her life because Maria was diagnosed with early-stage endometrial cancer. The key word here is sudden. If your periods have gradually gotten a bit heavier over several years, that might be normal aging. But if they dramatically change within a few months, that's your body waving a red flag. Another crucial sign to watch for is bleeding after menopause. If you've gone through menopause and haven't had a period for at least a year, any vaginal bleeding should be investigated immediately. This isn't about light spotting that might happen occasionally. We're talking about any bleeding that seems like it could be menstrual. After menopause, there's no normal reason for your uterus to shed its lining, so bleeding at this time is always considered abnormal and needs immediate medical attention. Here's a statistic that might surprise you. About 90% of women who develop endometrial cancer experience abnormal bleeding as their first symptom. But here's the part that's both encouraging and sobering. When endometrial cancer is caught early, before it spreads beyond the uterus, the 5-year survival rate is over 95%. That means if you pay attention to what your body is telling you and act on it quickly, the outcome can be very positive. Now let's talk about ovarian cancer, which is often called the silent killer because it's typically diagnosed at later stages. But it's not always as silent as people think. While ovarian cancer doesn't always affect your menstrual cycle directly, there are changes that can occur, especially with certain types of ovarian tumors. Some ovarian cancers, particularly those that produce hormones, can cause your periods to become irregular or stop entirely. If you're in your 20s, 30s, or 40s and your periods suddenly become very irregular or stop without an obvious cause like weight loss, stress, or medication changes, this could be a sign that something is affecting your hormone production. But ovarian cancer is tricky because it often causes symptoms that seem completely unrelated to your reproductive system. The most common early signs are persistent bloating, pelvic or abdominal pain, feeling full quickly when eating, and changes in urination patterns. These symptoms are so common and can be caused by so many different things that they're often ignored or attributed to other causes. Here's where it gets interesting from a cycle perspective. If you're experiencing these symptoms along with changes in your menstrual cycle, the combination should definitely prompt a conversation with your doctor. Your body systems are all connected, and changes in multiple systems at once can be more significant than changes in just one. Let me share Lisa's experience. Lisa started noticing that she felt full after eating just a few bites of food, something that had never happened to her before. Around the same time, her usually regular 28-day cycle became unpredictable, sometimes 35 days, sometimes 24. She also felt constantly bloated, like she'd eaten a huge meal even when she hadn't eaten anything. Initially, she thought she might be developing some kind of food sensitivity. But when these symptoms persisted for several weeks, her doctor ordered some tests that revealed early-stage ovarian cancer. The connection here is that some ovarian tumors can produce hormones that disrupt your normal cycle while also causing physical symptoms in your abdomen. Your body is an interconnected system, and cancer in one area can create ripple effects throughout. Now let's discuss cervical cancer and how it might show up in your menstrual cycle. Cervical cancer often causes bleeding between periods, similar to endometrial cancer, but the reasons are different. With cervical cancer, the abnormal bleeding often happens because the cancer cells make the cervix more fragile and likely to bleed, especially after things like sexual intercourse or even a pelvic exam. One of the key differences with cervical cancer is that you might also notice changes in your vaginal discharge. It might become heavier, have an unusual smell, or contain blood when you're not on your period. Sometimes the bleeding might seem related to physical activity or intercourse, which can make women think it's not serious or just a minor injury. The good news about cervical cancer is that we have excellent screening tools, the Pap smear and HPV testing, that can catch abnormalities before they become cancer or catch cancer very early when it's most treatable. But screening only works if you actually get screened regularly. Here's something that many women don't realize. Certain menstrual cycle characteristics throughout your lifetime can affect your cancer risk in ways that go beyond just the immediate changes we've been discussing. For example, women who start their periods very early, before age 12, or go through menopause very late, after age 55, have a higher risk of breast and endometrial cancers. This is because they have more total exposure to estrogen throughout their lifetimes. Similarly, women who have never been pregnant or had their first pregnancy after age 35 also have higher risks for certain cancers. This isn't about judging anyone's choices. It's simply about understanding risk factors so you can be more vigilant about screening and symptom awareness. There's also fascinating new research about the timing of cancer treatments in relation to menstrual cycles. Scientists have discovered that breast cancer cells are more susceptible to chemotherapy at certain points in the menstrual cycle, particularly when progesterone levels are low. This research is still developing, but it suggests that timing cancer treatment with your cycle might improve outcomes. But let's get back to the practical stuff. What should you actually do with this information? First, start paying attention to your cycle in a more systematic way. I'm not talking about obsessing over every little detail, but having a general awareness of what's normal for you. Consider keeping a simple period diary. You don't need a fancy app, though those can be helpful. Just note when your period starts and ends, how heavy it is, and any unusual symptoms. Many women think they remember their cycles accurately, but research shows we're often wrong about the details. Having concrete data helps you recognize real changes and gives your doctor valuable information. Here are the specific changes that should prompt a call to your doctor. Any bleeding between periods that's new for you, periods that suddenly become much heavier or lighter than usual, periods that last significantly longer or shorter than normal, bleeding after menopause, or any bleeding associated with pain, fever, or other concerning symptoms. But don't wait for your cycle to change to think about cancer prevention. Regular screening is crucial. Pap smears for cervical cancer, mammograms for breast cancer, and discussions with your doctor about your individual risk factors for other cancers based on your family history and personal health profile. There's also the question of when period changes are normal versus concerning. Some changes are expected as you age. In your 30s, you might start noticing that your cycles become slightly shorter or that PMS symptoms change. In your 40s, as you approach menopause, cycles often become irregular and you might skip periods or have them closer together. The key is distinguishing between gradual changes over months or years versus sudden, dramatic changes. Think of it like this. If your cycle has been a steady, predictable train schedule for years, and suddenly it becomes completely chaotic overnight, that's different from a gradual shift toward earlier or later arrival times. Let's also talk about some of the factors that can affect your cycle and potentially confuse the picture. Stress, significant weight changes, intense exercise, certain medications, and medical conditions like thyroid disorders can all impact your menstrual cycle. This is why it's so important to have a relationship with a healthcare provider who knows your history and can help you sort out what might be a normal response to life changes versus something that needs investigation. I want to address something that comes up a lot: the fear factor. Some women avoid paying attention to cycle changes because they're afraid of what they might find. This is understandable, but counterproductive. Early detection of cancer dramatically improves outcomes. Most cycle changes turn out to be benign and easily treatable, but the ones that aren't benign are much more successfully treated when caught early. Think about it this way. You wouldn't ignore a persistent cough, sudden severe headaches, or a suspicious mole on your skin. Your menstrual cycle deserves the same attention and respect as these other health indicators. There's also the issue of medical gaslighting, when healthcare providers dismiss women's concerns about menstrual or gynecological issues. Unfortunately, this happens more often than it should. If you bring up concerning changes in your cycle and feel like you're not being taken seriously, don't hesitate to seek a second opinion or explicitly ask for the specific tests or referrals you think you need. You have the right to advocate for your health. If your gut tells you something isn't right, trust that instinct. You know your body better than anyone else, and persistent symptoms deserve investigation even if they end up having a benign explanation. Let me share Jennifer's story as an example of effective self-advocacy. Jennifer started experiencing spotting between periods at age 45. Her first doctor told her it was probably just perimenopause and to wait and see if it resolved. But Jennifer had read about endometrial cancer symptoms and felt uncomfortable with the wait-and-see approach. She made an appointment with a gynecologist who specialized in women's cancers and requested specific tests. It turned out Jennifer had early-stage endometrial cancer, which was completely curable because she caught it so early and insisted on proper evaluation. The point isn't to second-guess every medical professional, but to be an active participant in your healthcare rather than a passive recipient. Ask questions, request explanations, and don't be afraid to seek additional opinions when something feels off. Now, let's talk about some of the encouraging developments in cancer detection and treatment. Researchers are working on new ways to detect cancers earlier, including blood tests that can identify cancer cells before they form tumors large enough to see on imaging. There are also advances in genetic testing that can help identify women who are at higher risk for certain cancers based on their family history and genetic makeup. For women with strong family histories of breast, ovarian, or other cancers, genetic counseling and testing might be recommended. This can help guide screening recommendations and prevention strategies. Some women at very high risk might choose preventative surgeries or medications to reduce their cancer risk. But even without genetic testing, understanding your family history is important. Cancer can run in families, and knowing what types of cancer your relatives have had can help your doctor make better recommendations about screening schedules and what symptoms to watch for. There's also exciting research into lifestyle factors that can reduce cancer risk. Regular exercise, maintaining a healthy weight, limiting alcohol consumption, not smoking, and eating a diet rich in fruits and vegetables can all help reduce cancer risk. Some studies suggest that these lifestyle factors might be especially important for hormone-related cancers like breast and endometrial cancer. Interestingly, some aspects of reproductive health that affect cancer risk are not entirely within our control, but others are. While we can't change when we started our periods or our genetic makeup, we can make choices about things like breastfeeding duration. Longer breastfeeding reduces breast and ovarian cancer risk, use of hormone replacement therapy, and lifestyle factors. For women considering hormone replacement therapy for menopause symptoms, it's important to discuss the potential benefits and risks with your doctor. Some types of hormone therapy can slightly increase the risk of certain cancers, while others might have protective effects. The decision should be individualized based on your symptoms, personal risk factors, and preferences. Birth control pills also have complex relationships with cancer risk. They appear to reduce the risk of ovarian and endometrial cancers, but might slightly increase the risk of breast and cervical cancers. Again, this is a decision that should be made based on your individual situation and in consultation with your healthcare provider. Let's address some common myths and misconceptions about menstrual cycles and cancer. One myth is that painful periods are always a sign of cancer. While severe, sudden-onset pelvic pain should always be evaluated, most period pain is caused by benign conditions like endometriosis or fibroids, not cancer. Another misconception is that you can't get pregnant if you have cancer. While cancer and cancer treatments can affect fertility, many women with cancer can still conceive. If you're dealing with a cancer diagnosis and are concerned about fertility, discuss this with your medical team as early as possible, as there might be options to preserve your fertility before treatment begins. There's also confusion about whether tampons or other menstrual products can cause cancer. The current research suggests that normal use of tampons, menstrual cups, and other menstrual products doesn't increase cancer risk. However, leaving tampons in for too long can increase the risk of toxic shock syndrome, which is serious but not cancer. Some women worry that heavy periods mean they're losing too much blood and might develop cancer from that. While very heavy periods can cause anemia and should be treated, the blood loss itself doesn't cause cancer. However, sudden changes in menstrual flow can be a symptom of cancer, which is why they should be evaluated. Now, let's talk about what happens after you've identified concerning changes and contacted your healthcare provider. The specific tests your doctor recommends will depend on your symptoms, age, and risk factors. For bleeding between periods or after menopause, you might have a pelvic exam, ultrasound, and possibly an endometrial biopsy, a procedure where a small sample of the uterine lining is removed and examined under a microscope. If ovarian cancer is suspected, you might have blood tests, including something called CA125, which is a protein that can be elevated in women with ovarian cancer, though it can also be elevated for benign reasons. You might also have imaging tests like ultrasounds or CT scans. For cervical cancer screening, the standard tests are the pap smear, which looks for abnormal cells on the cervix, and HPV testing, which checks for the viruses that cause most cervical cancers. The waiting period between tests and results can be incredibly stressful. Remember that most test results come back normal, and even abnormal results don't always mean cancer. Many abnormalities are benign or precancerous conditions that can be treated successfully. If cancer is diagnosed, the treatment options have improved dramatically over the past few decades. Surgery, chemotherapy, radiation therapy, and newer treatments like immunotherapy and targeted therapy have made many cancers much more treatable than they were in the past. The key is catching them as early as possible, which is why paying attention to your body's signals is so crucial. Let's also discuss the emotional aspect of dealing with concerning symptoms and potential cancer diagnoses. It's completely normal to feel anxious, scared, or overwhelmed when you notice changes in your body that might be serious. These feelings don't make you weak or overly dramatic. They make you human. Having a support system is crucial, whether that's family, friends, support groups, or mental health professionals. Many cancer centers have social workers and counselors who specialize in helping people cope with cancer-related anxiety and stress. There's also the challenge of balancing awareness with anxiety. Being informed about potential warning signs is important, but it shouldn't consume your life or make you constantly worried about every minor change in your body. The goal is to be educated and attentive without being obsessive. One approach that many women find helpful is to designate a specific time each month, maybe when you're updating your period tracking, to do a general body awareness check. Notice if anything seems different from the previous month, but don't spend every day analyzing every sensation. Remember, your menstrual cycle is just one piece of your overall health picture. Regular exercise, a healthy diet, adequate sleep, stress management, and maintaining social connections all contribute to your overall well-being and potentially to cancer prevention. There's also value in staying informed about new developments in women's health and cancer research, but be cautious about your sources. Stick to reputable medical organizations, peer-reviewed research, and established health websites. Social media can be a source of support and information, but it can also spread misinformation, so always verify important health information with qualified sources. As we wrap up this comprehensive look at how your menstrual cycle might be hiding cancer clues, I want to leave you with some key takeaways. Your menstrual cycle is a powerful indicator of your overall health, and changes in your cycle can sometimes be early warning signs of serious conditions, including cancer. The most important changes to watch for are bleeding between periods, especially if this is new for you, sudden changes in the heaviness or duration of your periods, and any bleeding after menopause. While most cycle changes have benign explanations, these particular changes warrant prompt medical evaluation. Remember that early detection dramatically improves cancer treatment outcomes. Most menstrual-related cancers, when caught early, have very good survival rates. This means that paying attention to your body and acting on concerning changes could literally save your life. Don't let fear prevent you from seeking medical attention for worrisome symptoms. Most concerning symptoms turn out to have benign explanations, but the peace of mind that comes from knowing is invaluable. And if something serious is found, early treatment gives you the best possible outcome. Be your own health advocate. You know your body better than anyone else, and persistent symptoms deserve investigation. If you feel like your concerns aren't being taken seriously by one healthcare provider, don't hesitate to seek a second opinion. Keep in mind that prevention and early detection go hand in hand. Regular screening tests like pap smears and mammograms, understanding your family history, and maintaining a healthy lifestyle all contribute to reducing your cancer risk. Finally, remember that knowledge is power, but it shouldn't be a source of constant anxiety. Use this information to make informed decisions about your health, but don't let it consume your daily thoughts or rob you of the joy in your life. Your menstrual cycle is a monthly reminder of the incredible complexity and resilience of your body. By understanding its signals and responding appropriately to changes, you're taking an active role in protecting your health and well-being. If this video has been helpful to you, please consider subscribing to our channel for more evidence-based health information designed specifically for women. We're committed to providing you with accurate, up-to-date information that helps you make informed decisions about your health. Share this video with the women in your life, your daughters, sisters, friends, and colleagues. These conversations can be life-saving, and by sharing this information, you're helping to break down the stigma and silence that still surrounds women's reproductive health. In the comments below, let us know what aspects of menstrual health and cancer awareness you'd like us to cover in future videos. Your questions and experiences help us create content that truly serves your needs. Remember, you have the power to be an active participant in your healthcare. Trust your instincts, pay attention to your body's signals, and don't hesitate to seek medical attention when something doesn't feel right. Your health is worth advocating for, and you deserve to be heard and taken seriously by your healthcare providers. Thank you for taking the time to learn about this important topic. Here's to your health, your awareness, and your empowerment to take charge of your well-being. Until next time, take care of yourself and listen to what your body is telling you.